This is the COVID Rapid Response Report and Asset Map, which back in the summer, a few months into COVID, our team had started to do, had just started implementation in the region, and sort of recognized that although COVID is quite different than flooding and other types of hazards, provides this profound opportunity to leverage lessons learned and think through particular vulnerabilities that have been exacerbated by this pandemic, but that are, true and historical and have been there, but also, play a role in other types of hazards as well. So we applied for this COVID rapid response grant here at the University of Virginia, and late last summer really started to launch this project. Ann Nelson, who's going to cover some more of the report in a couple of minutes here, was our lead student and research assistant on it, but we've had a number of folks work on this project as well. And the goal was really to understand how the delivery of critical services, which we've defined quite broadly to include libraries and mental health services and schools, and really a breadth of institutions, to understand how those services, particularly to vulnerable populations, were impacted by COVID, where gaps exist, and as well as opportunities for increasing resilience moving forward. So late in the fall into the early winter of 2021, we interacted with critical service providers, all online, socially distanced, but had really robust conversations with 63 folks. Many of them are you, and it just really had valuable, in-depth, rich discussions about COVID's impacts, about the challenges it has posed to serving community members, to the really creative and innovative ways that you all have adapted to this crisis, and troubleshooted ways to continue to serve folks in need. And I just had really broad, robust representation from 40 different community organizations and institutions in the region. Ann Nelson has worked very hard with input from you all to create this Northern Neck Asset Map, which we've popped in the chat here. We're still in the process of building this out based on the rich feedback and data that we got from you all in the process of working through this report. But the idea is to have this living, collective, community-owned platform of critical service providers where folks are located, what their service areas are, the hours of operation and contact information. And moving forward, we're thrilled that the Northern Neck Resource Council and Chad Lewis, who I believe is with us today, will be working with him to create a plan for how this map can continue to be maintained and updated so that it can continue to serve communities and critical service providers in the region. Another output of this is a final report, which has a lot of rich data, quotes, project highlights, and really centers the voices of you all and critical service providers in the region. It also documents populations that experience particular vulnerability and to experience chronic vulnerability in general in the region, and identifies things that worked well during COVID that could continue to improve access and opportunities for broader resilience planning, some of which are structural and will be a long process to see realized, and other things that really can be implemented in the short term. So I'll stop there and turn it over to Ann Nelson, who's going to cover a little bit more of the reporting process and also speak to her experience on it.
My name's Ann Nelson. I've been working with Sierra and Tanya at IEN, a little bit on the RAFT project, but mostly on this COVID Rapid Response project over the past year. And I'm so excited that this report is finished and ready to share with everybody. Thank you to all of those, especially you all who are here, which I'm so happy to see so many faces here who I know. Thank you for all your valuable insights and support and email communication back and forth that went into making this happen. I'm just going to scroll through it and kind of give people a sense of what's here, and then we can flag some of the sections that have more of the qualitative information shared by you all. One of the questions we asked everyone was what populations face exacerbated vulnerabilities due to COVID. And so this section starts to dive into which populations were most frequently flagged by social service providers and why their vulnerabilities were exacerbated due to COVID. And then after that, we get into barriers, specific barriers that are specific to the Northern Neck that these populations face when trying to access services. Broadband and Wi-Fi access was a huge one. Transportation and travel distances were also really frequently flagged, as well as knowledge of services and how to access them. And then we start looking into lessons learned and opportunities for increased resilience moving forward. And some of these lessons here, partnerships between organizations are crucial. That was highlighted by almost everybody we talked to. The importance of church networks in filling the gaps. The immense capacity to adapt to changing landscapes. We were blown away by how creative and just how hardworking all the service providers in the Northern Neck are to ensure that they continue providing their services. This section looks at things that worked well and will likely continue past COVID. And finally, recommendations for building more resilience in the future. And improved broadband internet access is one, and transportation services, more medical services, longer term investments, affordable housing, affordable childcare, economic growth and sustainable employment, data collection and tracking, and information dissemination during times of disaster. And this was a big one. So we created a couple graphics to share some information that we gathered through focus groups as far as which methods of information dissemination work and which ones don't, and the barriers through each one. And then the conclusion.